Greetings, everyone. My name is Nerea Hoft, Marketing Associate at Campbell and Company, and I would like to welcome you on behalf of our entire firm to today's webinar, Incentive Compensation in Healthcare Philanthropy, one of many in our free webinar series for 2015-2016. Today is October 14th, and we are broadcasting live from San Diego, Seattle, and Chicago. We hope you are all having a fabulous day, and thank you so much for joining us. Before we begin today's presentation, there are just a few logistics we'd like to get out of the way, which we hope will be helpful for those of you who may be new to our webinars. First of all, we'd like you to close any programs on your computer that are running other than GoToWebinar. Call in using your telephone instead of your computer speakers. Move your cell phone away from your computer. That'll help reduce any potential for feedback. And if you experience any visual issues, you can send us a chat or contact GoTo at 1-800-263-6317. Today's webinar will last 60 minutes, and you'll earn 1 continuing education credit that is good with your participation with CFRE International. About an hour after the webinar concludes, you'll receive an email from GoToWebinar that includes information on how to download your certificate, as well as a PDF of the presentation slides, a link to the recording, and information on how to register for any of our upcoming webinars. We do welcome your questions throughout the webinar. Please send them to us using the chat box in the GoToWebinar control panel that should be on the right side of your computer screen. If I can work your questions into the course of today's conversation, I will do so, but we'll also be holding time at the end of the webinar for Q&A. So next, I would like to take just a few moments to introduce the panelists. As you know, today we will be discussing the recent survey we conducted with leaders at healthcare fundraising institutions, and both of our presenters today were deeply involved in developing the survey and analyzing its data. Again, if you look over to your GoTo control panel, you'll see some handouts there, including a PDF of the survey report. So now I'm going to introduce Dan Neves. Hello, Dan.
Yes, I'm here.
Hi. Dan is a consultant in executive search at Campbell and Company, and Dan has over 2 decades of professional experience with 11 years in retained executive search. He has worked with clients on national searches for C-suite level leaders, including CEOs and CDOs in a range of sectors. He is a member of Campbell and Company's healthcare team and has led many of the firm's healthcare philanthropy searches, where he has had direct conversations with hundreds of fundraising leaders around compensation and incentives. Dan is also a former researcher in socioeconomic history at the University of Chicago, where he obtained his master's degree. He is currently based in San Diego. Welcome, Dan.
Thank you. Happy to be in this webinar. Thank you for everyone for joining us.
Great. Next up, I'm going to introduce Susan L., the Executive Director and Vice President of the Foundation for Barnes Jewish Hospital in Chicago, one of the nation's leading hospitals. Susan has over 3 decades of experience in healthcare philanthropy, leading successful fundraising teams at 4 major healthcare institutions in Chicago, St. Louis, and Cleveland. She has experience leading foundations, working with boards, planning and implementing comprehensive and capital campaigns, and building development operations in highly matrixed organizations and cultures. She is a former registered nurse and has a Juris Doctor degree from Washington University. Susan, thank you so much for joining us today.
Well, thank you, Nerea. It's my pleasure. This is Susan. Good morning, good afternoon to everybody for joining, wherever you are, for joining the webinar. Just one correction, Barnes Jewish Hospital is in St. Louis.
Oh, so sorry. So sorry about that. So with no further ado, I'd like to turn it over to Dan.
Thank you, Nerea. Thank you, Susan. First of all, thank you and good afternoon or good morning to our webinar participants, depending on your location. We're pleased to present the findings of Campbell and Company's national study on incentive compensation in healthcare philanthropy. and I really appreciate the time you're taking today to join us. We have over 106 registrants, perhaps more because of people sitting around screens right now. And many of the registrants are from the healthcare sector and health-related organizations. But we also have other participants from higher education, arts and culture, education, and a few from consulting and associations. So we're welcome and we're happy to have you join us on this webinar. Nonprofits more and more are really competing today to recruit and retain best fundraising talent, especially today when tenures are averaging about 2 to 3 years. After conversations with thousands of fundraising leaders across all sectors, our team has always wondered more and more about the use of performance incentives, and that's how this study came about. We focused on the healthcare sector since its use appeared more prevalent there. 44% in AHP's 2014 salary report reported receiving a bonus or incentive, as opposed to 22% in AFP's compensation report of the same year. So before we get into our discussion, we need to make sure that we dot our I's and cross our T's to discuss a few things. So for our purposes, the terms for incentive may be different in other settings. So it can be called a bonus or pay at risk, performance-based compensation, premiums, rewards, packages. There's different ways of expressing this. So we will focus on the term incentive when we discuss this topic, basically as additional compensation beyond annual base salary as a reward for achieving a set of goals. And as we'll see later in our discussion, it can be additional payment on a hire, or it can be a payment for long service as well. Campbell & Company's healthcare team led and facilitated this study, and Susan L., who is joining us, served as an advisor. So we are grateful for her counsel. She has been involved, but the findings and any errors or omission remain our own. Susan and I are not legal specialists in incentive compensation, and that's an entirely separate field in human resources and management and law. The survey was conducted in a very confidential manner, and so for these two reasons, we are unable to comment on really any specific incentive plans.
That's right, Dan, and thanks for the disclaimer. It's true. The study findings indicate that there really, we didn't find clear standards in incentive structures, and we'll be discussing that later on. But that makes it even harder to comment on specific plans. It makes it more difficult to comment on any specific plans. So it's more likely that all plans are really unique to each organization and individual leader. So before we get into the methodology of the survey, we would like to engage you in this and conduct a live poll right here, right now, by asking you to answer 2 questions that we will and share the results with later. So if we can have those questions up on the screen. Do you currently participate in an incentive program at your institution? Now, this survey was the survey that we're reporting on, talking about in this webinar, was focused on health care and hospital institutions, and we have a number of other institutions on the line with us today in this webinar. So if you would right now take a few minutes to take a few seconds and answer this question, we'll then put up a second question, and we'll include the results in our conversation later on. I'm filling time now. Okay. Second question. In what sector is your organization focused? Are you healthcare, education? Are you representing a human services organization, arts and culture, or other? So it's just kind of interesting, and it'll give some depth to the discussion later on.
I agree, and it's very helpful to know because we want to make sure that we know the study was very important for healthcare fundraisers, but we also see the impact of this information being helpful for other fundraising teams across all sectors. So please let us know what is the sector that your organization is focused so that we can report later about these results. Okay, so thank you very much, and that was very good points that you made, Susan, about no clear standards. And we're going to be turning to the survey methodology, and before we start, I just wanted to give a sense of the webinar. We're going to be covering 5 main points. First, survey methodology, followed by a talk on beliefs and attitudes around incentives, and then an overview of incentive structures, and then discuss the similarities and differences for incentives, and then we'll wrap up with characteristics of effective programs. So let's start with the survey methodology. So our purpose was to achieve 3 chief objectives. First, we wanted to understand how healthcare institutions are rewarding top fundraisers. We wanted to really learn the norms for performance incentives and healthcare philanthropy. And this was completely unknown, and there are no deep relevant studies available. And finally, we wanted to examine the beliefs and perceptions on incentives among healthcare fundraising leaders to very much understand if there are people who are in favor of the incentives, is there not favorable incentives. There's been a question about the use of incentives and an ethical question. So we're going to discuss that a little bit later. We emailed the 55-question survey to over 500 leaders in different healthcare institutions in the spring of 2015. We specifically targeted the top healthcare philanthropy leaders among a variety of different institutions across the United States. Participants included healthcare foundation CEOs, presidents, or executive directors, or a healthcare institution's chief development officer, vice president of development, or vice president of advancement. There's some fluidity here in these terms, but what we're really trying to get to were the top-tiered leaders in each of the foundation or the healthcare development system. The survey was conducted between April and May of 2015, and we received responses from 81 institutions. So our response rate was 16%, which is well within the general norm for surveys. Well, many of our respondents, and I know that this is a lot of information here, but let me go over it. Many of our respondents came from large institutions. 60 of our respondents came from academic medical centers, community hospitals, and system-owned hospitals. That was, as you can see, the majority of our respondents. Over 80% of the institutions had a geographic service area that was locally or at a state and regional level. Many respondents worked within healthcare institutions with greater than 100 beds or more, with our largest group from 500 beds or more. Most institutions had fundraising budgets up to $5 million, and 15 respondents had fundraising budgets greater than $15 million. So salary and benefits. These leaders tend to be well paid in annual base salary. 75% of the leaders earned more than $150,000 in 2015. Most, 36%, earned above $250,000. So that's really great salaries, and I'm sure we're all admiring them for those large salaries. While 25% were paid below $150,000. Top benefits included insurance, either health, life, or disability, professional dues, computer, reimbursement for tuition, and cell phone. And I really think it's a nice benefit to see both professional dues and tuition reimbursement indicated highly here because it shows that healthcare organizations really want to professionally develop its leadership. So I think that's nice to see these benefits at the top.
That's right. One of the things that you mentioned that we really wanted to understand and take a close look at and see what we could learn about what are the prevailing beliefs and attitudes around incentive programs, because of the sometimes different terminology. We were curious as to what the perceptions are and what leaders think. So we asked the healthcare fundraising leaders about their attitudes and beliefs around incentive compensation, and most responded, and there were some key takeaways from our respondents. Most respondents believe that there really is no ethical conflict in incentive compensation. 75% of the respondents felt that way. 64% of the respondents indicated that they are likely to stay in their current position if they receive a performance incentive. And then 74% report that all nonprofits, exclusive of healthcare, the opinion is that they should also have performance incentives in place for fundraising staff.
Yeah, these are really high numbers, and it's clear that with senior chief development officers and foundation CEOs, there is no question about a problem of receiving incentive, and I think that's true with counterparts within their own healthcare systems. Many of our respondents, I just want to comment, Susan, is that they had at least 10 years of experience in healthcare philanthropy, and the majority had served at least in 4 different fundraising roles in their career. So these are very senior executives that we're seeing these type of responses from.
Right, and the definitions are so important. I think we all kind of agree or have the sentiment that percentage-based commissions or contributions that are on contributions that really look and feel like they're a commission may raise ethical questions and concerns. But comprehensive incentive structures and plans that adopt a pretty wide range of not only revenue but non-revenue goals that are in line with prevailing practices within that organization's priorities and objectives are generally accepted by the fundraising associations and in the industry, is what we found. So what else are the leaders thinking? 67% believe that their incentive programs are effective or even highly effective at motivating higher individual performance, and more than half, about 55%, believe that incentive is effective or extremely effective in increasing team performance.
I think this is interesting. So, you've served, Susan, in some really great healthcare institutions, both in Chicago, St. Louis, and in Cleveland. So, what is your own reaction to this type of general beliefs or thoughts?
Well, my individual belief is that given that performance incentives are not a commission, that it's performance related, it really is part of a total compensation package, for one thing, but it is also part of the goal-setting process, and it instills a really stronger sense of collaboration, cohesion, and organizational commitment, which really lends itself to a strong team environment and teamwork, which is to the greater good of the entire organization.
Yeah, whenever I had conversations with fundraising leaders in healthcare, sometimes there is, a visceral reaction, particularly for leaders who may not have an incentive plan. So when I talk about an organization that might have an incentive plan, I've had some really interesting reactions that leaders were not in favor of this type of incentive, and it's usually, again, when they haven't had an incentive plan of their own. When they're on an incentive plan, I think that changes the perceptions, and they see it differently. There's actually, I've had a conversation with a large national healthcare organization, and I had a conversation that consisted of both the senior staff and of the board. And they didn't really have an incentive program in place, but they were interested in understanding what incentives were, and they actually spent a lot of time talking to me about this, and I got to listen to some of their reactions, and I'd like to probably share that here. You know, the board members, when we talked about it, one of the board members particularly cited that they didn't want to see an incentive that was based on an individual's focus. And this board leader would use the term greedy center filter. They didn't want to have a greedy center filter involved within the team, and I think that everybody agreed in that kind of sense that that was not ideal. And one of the staff leaders who happened to run the development operations, you know, she was really concerned about the program being focused solely on the fundraising leadership or the frontline fundraising team, and not really incorporating some of the back office leaders. And I really think that these are valid concerns, but I think that our study shows that, you know, effective programs can really overcome some of these concerns.
Well, that's right. It comes down to what are you trying to incent, and the way you set the goals and objectives or the components of the program, of the incentive program, can motivate total team effort or recognize total team effort, as long as, and we'll get into it a little bit in a few minutes, of the tiering of participation, but also the tiering of the goals and what it is that you're measuring and incenting and how it's structured, so that there are organizational goals, team goals, and individual goals or performance objectives. And I prefer to be more democratic in that as many as possible on the team should be able to share in any incentive plan that exists, because no one team member does it all. And it's just, but that's, you asked earlier about my personal opinion, and I tend to be more democratic about it.
And then from my anecdotal evidence, just from a conversation, is that I hear from leaders is that, you know, they want to make sure personally that they would like to have their goals and objectives tied more towards the strategic goals of the organization, because when their efforts are tied to the strategic goals, they're valued not only by their leaders, the leadership, the executive team, but they're also valued by the board, and that the board understands and sees the value of the connection between the strategic goals of the organization and the efforts of the team working together for organizational or overall organizational performance.
Right, right.
So let's turn to our polling. So our polling is showing so far that we have 40% of the participants on our webinar are receiving an incentive of some kind, and that the majority, 58%, are not receiving an incentive at this time. So I find that very interesting. And then 2% indicated that they're unsure, which could mean that they are potentially on a different type of incentive plan, and it may not include fundraising goals. I don't know. The breakdown of our participants who are joining us is that over half of the participants are from the healthcare sector. 22% come from the environmental sector. 12% come from human services. And 4% comes from arts and cultural organizations. And then there's a 12% other, and I probably recognize that, we have a correction.
This education, yeah.
Education. is 22%, not environment. Sorry about that. Education is 22%, healthcare 50%, human services is 12%, arts and culture is 4%, and then we have an other 12%, which I could see from the list of participants that might include associations, or it might also include consultants or leaders who are involved in HR and compensation. So first of all, thank you so much for participating in our polling, and I appreciate that we have a good showing of people who do receive incentives, but also people who are probably wondering and wanting to know more about incentive programs for their organization.
Dan, quick question from the audience. Do you recall what the geographic spread was of the respondents for the survey, or at least the group of 500 who were invited?
That's a good question. We actually did a nationwide survey, so that we try to focus as much on the East Coast, on the West Coast, and in the central United States as much as possible to get a nice broad sample. Most of the respondents came from a variety of areas. I would say that the majority of our respondents came from the West, meaning west of the Mississippi, then from the East.
Thank you.
So let's turn to incentive structures. So we're going to focus on talking about incentive structures on different types, and we'll focus on first prevalence and definition, and then we'll get into the eligibility for incentives, and then discuss key factors around them and different types of incentives. So 62% of respondents reported that they had incentive programs at their institutions. So of those, 83% received an incentive in 2014. So many fundraisers in 2014 had a good year in achieving their goals, and they were actively engaged in performance goals resulting in an incentive. No clear standards. There's no real clear standards around incentive programs. We identified some consistent types and structures, which we're going to talk about here, but I think that it's important to think about that these incentive programs are really designed around the organization itself, the team, and the individual leader who is involved. So there's different ways that you can incentivize a leader within an organizational environment. The most prevalent was the annual incentive. So 94% of people who received incentives received an annual incentive. Interesting that there were 21% who reported that they received multi-year incentives. And we're going to talk about these type of incentives later. So who is eligible for incentives? So clearly, looking at this list, our reaction is primarily management-based programs. So we have a real clear distinction of leadership here. 90% of healthcare foundation presidents and CEOs are eligible for incentives. 79% who identified as healthcare chief development officers were eligible. 79% of the VPs are eligible, and 75% of the director-level employees. So the high number of management-based eligibility here indicates a pattern. Let's look at the other numbers. Others eligible included 25% the frontline fundraising employees, and if Susan had her way, 21% all employees. So interesting enough, most incentives went toward the senior level staff, and as was raised in the conversation that I had with in another organization, it wasn't really focused on frontline fundraisers per se. And I think that was an important piece that came out of this survey.
And that's something that would be a correlation in that we surveyed, or the survey participants were with hospitals, hospital systems, and healthcare organizations, and it's common in those organizations that at that executive level, the VP level and higher, that those institutions often have incentive or performance programs in place in the hospital, not in the fundraising organization. And also in those related fundraising organizations, sometimes the metrics that the fundraising executive participates in are the hospital's goals: patient safety, patient quality, and readmissions and things like that. So that might be unique to healthcare institutions.
And so,
and why they're at that level, at the director and vice president and above level.
So in a way, Susan, I think that with the healthcare systems, because they are some of the executive team or members of the hospitals may already be on an incentive plan, that it's probably the reason why we're seeing much more higher prevalence in healthcare sector for healthcare fundraisers, because it might be easier for them to get an incentive plan for the fundraising team if the fundraising team is at these senior levels.
Well, also because it's already part of the institutional culture.
Right, right, and that's a very good point. And I think that affects why we're not seeing more money than some leaders might think who are not in incentive programs, seeing that money is being directed towards the frontline fundraisers to add more money to their compensation plan as well.
Right, right.
So important factors. So there are many important factors in determining incentives, and there were cumulative top factors that were rated by each leader. So in this case, during the questionnaire, leaders here could choose more than one factor, so that's why we have these high numbers here. So the top three, as you can see, were attainment of overall organizational goals. So this is very important to our respondents, and I think that high indication is important. Attainment of individual performance goals was second, and then attainment of overall development revenue came in third, and also meeting and exceeding revenue targets, meeting and exceeding revenue targets could be either individual or the team. So I just want to make that clear. And then attainment of team performance goals, and also meeting and exceeding non-revenue targets. So these were some of the primary factors that really affected the incentive. So what were the revenue categories? 75% indicated that new gifts or new business more generally was the revenue category that was important. And this is cash received in 2014, but not previously pledged. So cash that was received in the year, but not previously pledged. And then 67% reported new pledges. So pledges that were received in 2014. This is now, I'm talking about the year that they received their incentive now, not the current year. So pledges that were received in 2014 that will pay out in 2015 or later. 23% indicated payments on prior year pledges. So that could be cash received in 2014 or pledges that came from prior years. And then 23% reported other. So there was different types of revenues that might be unique to the organization or as Susan said, might be tied to bigger organizational elements, which could be, as Susan mentioned, patient safety, patient quality, overall hospital performance. But it also might be tied to the financial performance of the institution or around issues around budget. These might be important categories as well.
And Dan, I'm going to interject here off script a little bit that although while we're in revenue categories right now, that 23% payments on prior year pledges could also fit into a non-revenue category of a measurement or a metric against collections or stewardship. Because if you don't collect on those prior year pledges, then eventually your organization is going to have bad debt to report. And so that kind of a measurement is an example of one that would meet both a revenue and a non-revenue kind of category or achievement goal.
Yeah, that's a very good point. Thanks, Susan, for raising that. And if you don't make your money, yeah, if you get a pledge, it doesn't mean that the pledge is going to come in each and every year. So if it's
an organizational effort to collecting, right? And that has to do with donor stewardship. And so that's a way of incenting a more comprehensive plan of performance.
Yeah, and I agree, and I think that shows the importance that all the team are involved in making sure that donors are involved and kept abreast of their pledges and that they're stewarded well. So I think that's a good indicator for good performance. Let's talk about performance types. So respondents were asked to determine what percentage of individual, team, and organizational performance factored in determining their incentive. So all incentive-based programs use one or more of these three types here. So when asked to weigh out the three criteria, organizational performance is rated higher than individual or team performance. So organizational performance was at 41%, while individual performance and team performance were at 34% and 25%. And I think this here connects with the slide that we had with the 96% of the respondents indicating that attainment of overall organizational goals were very important. So I think that here, if I had an imaginary pen for this webinar, I would really underline twice this organizational performance because I think that this is a real prime factor that's showing. What is also interesting here is that a majority of our respondents indicated that they used a percentage of all three of these performance types. So let me give you an example of this. So if you are a leader receiving an incentive, you may be weighted on three different areas. One, you may be weighted towards organization, which might indicate or might be 50% of the value of your incentive. And team, if you're leading a team or managing a team, their success may affect 25% of your incentive. And that if you're also having your own portfolio and your fundraising, you might have an individual objective of 25% weight. So 25% individual, 25% team, 50% organization. As a whole, that's 100% of the value of your incentive. And how that would be paid out is that if you're, and we'll just say as an example, a leader is making $100,000 as their basic annual salary. They would receive, if they hit all their objectives, organizational, team, and individual, they would get 100% of their incentive. So if their incentive was up to 20%, they would potentially receive at the end of the year their annual base salary of $100,000 plus the 20%, which would be $20,000 if they hit their goals. Now, how about if they only hit their individual goals and their team goals, but not the organizational goals? They may be allowed to collect 50% of their incentives. So that would be $10,000 at the end of the year. So I just wanted to make this clear about how actually incentives are received. You know, nearly all incentives are received as a percentage of salary. So just to make that clear, that's pretty much standard. You know, respondents report amounts as low as 3% or as high as 70%. And looking at the distribution here, excuse me. Oh, I'm sorry. Sorry about that. I missed a slide here. So we're going to go into similarities and differences, and both Susan and I will cover this. So let's go into this area now.
Before, I just want to comment there, something that wasn't in, it was too detailed to be in the study, is that with each of those targets, there's usually a range. So if you have 50%, most plans have that as part of their structure. So there's a minimum goal, a target, and a maximum that that you could achieve. I just wanted to add that.
Yeah, and so you know, looking at the respondents' report for size of incentives, they could be as low as 3% or as high as 70%. In our survey. And then looking at the distribution here, 1/3 were receiving less than 10%. And this category reflects a greater number of organizational incentives, possibly, or perhaps institution-based incentives where the Chief Development Officer is part of the overall team. It's really hard to say. In general, incentive percentages range up to 30%. With those above 30% being less common. Susan, what's your...
Very less common. Yeah, I'd say very less common. That sounds really high, and 70% sounds like really high. It starts to sound unusual to me, but someone has it. With some development teams, there are often, and there can be, tiers for different leaders. For example, the CEO or the Chief Executive Officer or Chief Development Officer might have an incentive up to 30%, and then the Vice President level staff might have an incentive up to 15-20%, and Director level staff up to 8-15%, and so on. And although the study doesn't indicate these tiered structures, it's most likely the case with most healthcare fundraising plans that there is that tiered structure built into it, along with the tiered organizational team and individual goals, each of those levels having all of those, just at different targets.
And generally, and that's a great point, Susan. And also, generally, when I have seen healthcare fundraising leaders receiving an incentive above 30%, that might be because of their annual base salary is kept within a certain salary structure, and that they're being paid in a different way to offset the salary structure to maintain equity within the organization. So I think you and I had a conversation with this earlier where you made a good point of saying you should probably check their annual base salary if they're getting a very high incentive above 30%, which I think was a great point.
Right, and it goes back to the fact that when you're talking about these, it's one part of a total compensation package. And so it needs to be talked about in that.
Right, as a whole, and not as separate parts.
Right. So we move on to non-revenue categories?
Yes.
Okay. And so when our respondents were asked the question, what non-revenue categories does your individual incentive plan include, they could choose more than one answer. But 54% indicated the management, leadership, and total gifts secured as the top non-revenue goals. Other top non-revenue goals included number of proposals and solicitations made, stewardship, visits and contacts, and you can see the list there on your screen. I think, again, I'm going to triple underline organizational performance goals for you, Dan, because I think that management, leadership, and total gift secured indicates that it's a total team or organizational results that rank up there in that non-revenue category. Just on a personal note, I might be concerned if solicitations, just number of solicitations, was a target in an incentive plan. And why, you might ask, is because if you're incenting, just make the solicitation, you're not taking into consideration all the other factors that go into the timing of the solicitation. So if you're thinking about what non-revenue goals belong in an incentive plan, I would take those things that are going to advance the organization and those things that are going to align with the total organizational goals would be the measurements that I would look for, and not things that are pure activity.
Yep.
I would have more at production goals than activity goals.
And then the stewardship piece is getting a high response. Also indicates the point that you were making about prior year pledges and how important it is to focus on stewardship. So, recruitment incentives. So, we focused on understanding what incentives look like for recruitment and retention incentives. I'm going to discuss recruitment incentives, and Susan's going to talk about retention incentives. So, better known as signing incentives or bonuses, these are ideal for attracting fundraising talent to the organization. 42% of our respondents indicated that their organization was using signing incentives to recruit leaders. That's a high number. Some individual examples cited were 10% of annual salary as a signing bonus. Now, these are just individual examples, not consistent across the board. Signing bonus used to cover a potential forfeit of an incentive from a previous organization, or a signing bonus in lieu of relocation expenses.
And as for retention incentives, the survey did reveal more information about those, and they're really great for retaining talent and rewarding long tenure and service. 27% of the respondents reported them as being used at their current institutions. And there was really a variety of examples that were reported, and here are a couple. Multi-year fundraising campaigns where an employee can receive deferred compensation, which would be part of the retention plan, if they are still employed at the end of the campaign. And I think many organizations use these campaign-related for retaining through the life of the campaign, in addition to campaign success. Another example would be a multi-year vesting period based on percentage of annual salary, and another one would be 5-year incentives for lengthy service. I've also seen places offer a contribution to retirement plans if you are employed for a minimum number of years, and could also be the number of years could be related to a campaign or may not. And in fact, at one institution, it was a requirement that you would be employed at the end of the year in order to receive your annual incentive. And so this is an example of what I look at as a short-term retention plan. For instance, if you left the organization on December 1, then you would forfeit your annual incentive, which would be assuming the fiscal year and the year was being measured by the end of December. And I have seen that effectively used. So that is an example of a short-term retention plan. But these plans for both signing and retention vary greatly and are not used everywhere. Would you agree, Dan?
I would agree, and but I think that they show that some of the organizations are thinking beyond an annual incentive and being a little bit more robust in dealing with a market where there isn't a high number of excellent fundraising talent out there to be had. So they have to think creatively. And I think these type of incentives gives the organization and the leadership much more flexibility on how they can recruit and retain talent. One important thing is, I think this is a good point about the forfeit of a bonus. If you leave your organization, or you're leaving your organization, please think about when you're coming to a new organization before you sign on that dotted line to talk about what you would potentially forfeit in your incentive. So that's important. So sometimes leaders forget about that when they're having a transition piece. So let's talk about the characteristics of effective programs and what we found. So many of the effective program practices that we discovered and had conversations with leaders, we wanted to make sure that you understand that, you know, this was a survey and was based on self-reported results only. So it's not any kind of scientific evidence that we're presenting here. It's mostly reported from our survey participants. But generally, effective programs go beyond the annual incentive to attract talent, using signing bonuses or add retention incentives to keep leaders in place, particularly for lengthy fundraising campaigns. Effective programs go beyond the annual incentive. Effective programs may include non-revenue categories, for example, number of solicitations or total number of gifts secured. And most importantly, successful incentive programs tend to prioritize organizational performance and goals over individual performance.
Right, and seeing what we have observed in that tiering that we talked about, and the really high premium that's put on organizational performance, there's really a parallel between organizational performance and management-based incentives. I think the thinking there is, and the data shows that the most director level and above leaders receive those incentives, and it may be because they have the span of control over the organization's performance and the organization's success.
And I think that it's easier for organizations also to kind of tier those type of leaders because they have it already in place. And it makes it easier for healthcare organizations or health-related organizations to have those type of incentives structured when that's already there, and it's modeled and mirrored on the others within the organization as a whole. So now we're going to turn to your questions. So are there questions that you might have that you would like to know more about incentives? We'd love to hear them.
Thank you, Dan. This is Nerea, and yes, we have gotten quite a few questions throughout the webinar. Many of them you answered as we went along, but there's still a few hanging out there. First of all, this question is, we don't have an incentive program at my organization, and it's hard to imagine creating a culture that is open to having one. How do I get the ball rolling? How do you begin to build a culture conducive to incentives, and where do you begin building a program?
Yeah, that's a very complex question. I think that the starting point really is having a dialogue, and dialogue is with your manager or supervisor, and you've got to be able to think about that incentives are not simply elements within your own pay or your own compensation, that they really are something that affects the entire organization, so that the executive team would also have conversations with the board and to the compensation committee of the board to have a new incentive plan or have incentive plans put in place. So really, overall, when you ask about the culture of incentivizing performance, you're talking about all the organization being involved, meaning the board and at the staff level. Susan, did you want to add something?
Well, and there may just be an element of education along the way that's necessary with the board and your human resources department and leadership in that performance incentive programs are not the same as commissions, and what are the reasons? What are the gaps? What will this add to, an already strong? How will it make the program, even your overall program, even and staff even stronger? The motivational part of it.
Great, thank you. Could you speak a little bit more to one of the questions we had was how do these incentive plans differ from corporate sales incentives, and how are these different from commission, and how can you communicate that to folks who might have some their stigma around the idea of implementing this kind of program?
Well, usually in corporate organizations, you see higher levels of incentives, so that you would probably see within the for-profit sector, it could be as high as 80% of organizations are involved in some type of bonus plan or incentive plan. And so I think there's a distinction between commission versus what is a bonus. And I think even AFP, when they discuss this question about percentage-based commissions or finder fees, which they find unethical, and I think it's very strong points that they draw. The distinction is that the bonus itself is not, the bonus or incentive is comprehensive in nature, so that you're not being incentivized purely on dollars raised, and that you're incentivizing performance, and that you're looking at a wide categories or factors that might be involved within your incentive. So when I see incentive plans, particularly for nonprofit organizations, they generally have 3 to 5 categories that they choose to incentivize one of the staff. It could be the executive director of the organization, which had that conversation with the board, or it could be a staff member. And whatever is the important categories would be weighted to that. So the difference between commission and sales, it's clear in that kind of context within a for-profit. If you drive $500,000 worth of revenue, you'll get 20% to 25% of your revenue as a bonus. But within the nonprofit sector, it's much more complex. And you've got to ensure, particularly within a fundraising team, that it's much more comprehensive in nature and not based on dollars raised. Susan?
Just a couple points. Everything you said, yes, but and this is in no particular order. Take in mind, consider what the organization or the institution that you are at. What is the current philosophy? Are there any incentives anywhere in the organization, let alone in the development or philanthropy or foundation office? Anywhere, are there any incentives? And if there are, then you have something to work with. And if there are not, I worked at one system where it was a no bonus organization, top to bottom. They were just philosophically not ever going to have an incentive or a bonus. You could call it whatever you want. Was not going to have it. And so, I wouldn't even tackle it in that setting. And another consideration is if you are in an organization or have a team, or if you are leading an organization where retention is an issue. With the tenure of fundraisers and those in our profession being what it is typically, you invest a good deal amount of effort and time in developing and growing your staff, and if retention is a problem, or even if your organization has decided to not have the same level percentage merit or increases or annual increases, that this is a solution. This is one possible option for the organization to consider, because if you put it in terms of dollars and cents, you're losing money if you're losing staff. And if you could retain them by adding this level to their compensation package, or at this option even, it's pay at risk, it's compensation at risk. And that's a point for persuasion, or 2 points.
Thank you, Susan. Well, we have come to the end of our scheduled time here. So on behalf of Campbell & Company, we'd like to thank you for joining us today. If we didn't get to your specific question, or if you wake up in the morning and think to yourself, oh, I should have asked about this, please feel free to shoot us an email. We hope you'll also take a moment to fill out a very short survey about your experience today so that we can continue to improve our webinars in the future. That survey should pop up on your screen as soon as the webinar ends. We also hope you'll join us for other webinars in our free series. Coming up next Wednesday, October 21st, is Tackling the Next Frontier, Case Messaging for Environmental Organizations. Thank you to Dan, and thank you so much to Susan and everyone who was able to join us today. We hope you have a great day.
Thank you.
Thank you.